Dr. Jaffe, how long do you recommend a patient strictly consume 60 to 80% alkalinizing foods based on the food effects for body chemistry chart that you have before they retest their first morning urine pH? So basically, how long does it take for these foods to take effect?
Well, there's a couple of different questions, and I want to unpack them. In regard to the food effects on body chemistry chart, that is different than the acid ash residue charts that you see elsewhere. It is more accurate because it's complete. It's not just based on how much mineral there is or is not in that ash residue. So with regard to the 80%, you want to keep 80% alkaline foods until your digestion is back to normal, until your metabolome, which means your hormones, neurochemicals, and immune defense and repair system are back to normal, back to tolerant and resilient. So what does that mean? At least 6 months. At least 6 months. Give it a chance. Because the day you start the next phase of your life, you still carry with you your history. So it takes a while for the good digestion to come in. In fact, it very often takes 2 or 3 cycles of 6 months. This is a marathon, not a sprint. When you're well and happy, when you're getting restorative sleep, when you're very productive, when your energy is high, when you're feeling well, then you can go to 60%. You can have a little more acid-forming food. I actually keep to 80% all the time, myself. Personally, I feel better. And I don't miss the others. But every once in a while, I go and I have something acid. Look at the acid-forming part of the chart. Does Dr. Jaffe have any of that? Yes, sometimes I do. It's meant to be 80% or 60%, not 100%. So that's that. Now, the other question is, how often should you be measuring your morning urine pH? And that's every day, and keeping a log of what the urine pH and how you feel every day is, because the urine pH after rest, after 6 hours of rest, so that the fluid in the bladder equilibrates with the bladder lining cells, that fluid, the first morning urine fluid, tells you how much magnesium you need based on how many toxins you were exposed to yesterday, how much stress you were exposed to yesterday, what happened in addition to what is metabolism yesterday. So we measure urine pH every day, and we adjust 2 or more doses of magnesium and choline citrate based on the urine pH. So both are important. I hope that's clear.